COVID, turns out, was not a public health event. Turns out it was actually a military program. And we have two incredible guests joining us who've done some groundbreaking research on the details on what this means. I mean, a lot of us saw the Department of Defense being involved. Like, that's weird. But no, it gets way, way weirder. Thank you for joining us today on Behind the Deep State. I'm your host, Alex Newman, Senior Editor at the New American Magazine. It's wonderful to be with you today. We're so grateful that you could tune in. And our guests today, I'll introduce them before we start talking about this report. But we've got with us some really, really fascinating people. First, we have Debbie Lerman. She is a researcher, a writer on Substack, and she's also a fellow at the Brownstone Institute, a very, very important organization that's been kind of at the forefront of exposing some of this weird stuff going on with COVID. She has a degree from Harvard, but as I told her before we started, we won't hold that against her. Plenty of decent people have gone to Harvard in the past. And then our other guest, she's actually a returning guest on this program. We've had her on before. Her name is Sasha Latypova, and she has a very, very impressive biography. We'd have to spend 5 minutes going through the whole thing, but a couple of the highlights. She's got an MBA from Dartmouth. She spent 25 years of her professional career in healthcare technology, medical device, and pharmaceutical research and development industries, both in the United States and Europe. She's worked in drug development across various therapeutic areas, including infectious disease drug development. She didn't work on vaccines, but later in her career, she owned and managed several contract research organizations where they did contract work for over 60 pharmaceutical companies worldwide, including, incidentally, Pfizer, one of the major clients and R&D partners. She's got a lot of experience in this area. She's spent a lot of time interacting with the FDA, the EMA, the European Medicines Agency, the Japanese version of the FDA, and regulators across the board. So she really has a lot of experience in here, and she has brought out a lot of the groundbreaking information and research that we need to know. She became concerned about what was going on with the mRNA gene therapies masquerading as vaccines and started digging, and what she found has been incredible. She's developed quite a reputation over the last few years for exposing some of this, not just with the vaccines, but with the lies. And she also has a wonderful Substack that I subscribe to. It's called Due Diligence and Art. I encourage you guys to take a look at that. Now, these two ladies have a new report out, the COVID Dossier. It is a record of military and intelligence coordination behind the global COVID event. And folks, I'm telling you, it is a bombshell. Let's start with you, Sasha. Thank you so much for joining us, and Debbie, also thank you for joining us. You say this was a military operation. I think for some people that's just like outside the realm of what they can even fathom. What do you mean by that this was a military operation?
Yes, so I started publishing on the fact that it is a military operation quite some time ago, and Debbie found some really key documents that confirm this. The fact that it's a military operation was presented to the public as if it was only a logistical capability of the Department of Defense to distribute vaccines. But from the very beginning, from the organizational charts that became available of the Operation Warp Speed, it was clear that that wasn't just the logistical capability. The chief operating officer of the Operation Warp Speed was explicitly Department of Defense, and that's what I found pretty early on and started talking about. And the Health and Human Services was strangely only a science advisor, so not even a kind of an operational executive role. And then I was also concerned about the fact that all the contracts, and I think I discussed it on your show before, all the contracts for all the vaccines and all therapeutics and diagnostics and everything to do with COVID were ordered through the Defense Production Act and using other transaction authority, which is a very opaque, secretive mechanism of buying, and primarily it's used to buy weapons or secret technologies. And the contracts that were disclosed later were heavily redacted and showed evidence of complete sort of deregulation, no accountability. The EUA legal framework explicitly allows for these products to be completely deregulated. So no good manufacturing practices apply to them to date. They don't have to be compliant with anything. Distribution doesn't have to be compliant. They can be freely adulterated or misbranded. The US law explicitly says so, that these things can be adulterated and misbranded, and it's not a crime. While in a normal pharmaceutical practice, it's a crime. So all of this combined, I just couldn't believe my eyes when I saw it, and I knew it was a military operation. But what Debbie uncovered became really a key piece to this.
Excellent. Well, let's go over to Debbie now. Debbie, I'm really curious about the NATO involvement here. In this report, you guys talk about what happened on February 4th. This declaration was issued for CBRN, which I guess has to do with weapons of mass destruction emergencies. Talk to us about the documents and the information that you found that add a whole new layer to the mystery here.
Sure. Thanks a lot, and thanks for having us. So Sasha, while she was working on all of the contracts and agreements and pharmaceutical side of things, I was looking at the administrative side of things. So I was trying to find out what the actual official government plan was for the response, because, the government has plans for things and that should be public knowledge. What were they planning, and were they executing the plan according to something that they had already devised, or were they just making it up as they went along, or were they making lots of mistakes, as everybody kept saying? And what I found was a document which is called the Pandemic Crisis Action Plan, and that is the government's plan to respond to the pandemic. It's adapted to the COVID pandemic specifically, and in that plan, which is a very convoluted document because it's a document that was originally updated in 2018, and then they added all kinds of weird stuff for COVID. And one of the very weird things that they added on the org chart is that instead of the HHS being the lead federal agency, which is actually specified in law that they're supposed to be, all of a sudden there's a task force, which we all know because we were told that was Deborah Birx and Tony Fauci and those people. But actually the task force is run on behalf of the National Security Council. And the National Security Council is in charge of policy. That means they determine what the response is going to be. The National Security Council is the body that advises the president on military and terrorism. That's it. They've changed the definition now to add pandemics and stuff like that. But in 2020, it was still just a military and intelligence advisory body for the president. So when I saw that, I was like Sasha, I had a fall off my chair moment where I thought, okay, so actually the whole thing was not a public health response. It was a national security response. Yeah. And that's where it started.
So this is fascinating. What does that actually mean to a layman? What's the difference here between like a public health crisis and a national security crisis? And does this mean, for example, that they thought this was a bioweapon attack? Does this mean that they were in on it? I mean, what is this? What are the implications of this?
Mm-hmm. That's a really good question. So what we tried to very much emphasize in the dossier, in the COVID dossier and in all of our work, is that it doesn't matter so much whether it was a bioweapon or not. It was treated as such. So the response was a response to a bioweapon attack. Whether there was whether the virus was a bioweapon, whether there was something else that they considered a bioweapon, whether there was nothing at all, the response was a national security CBRN, that's chemical, biological, radiological, or nuclear response. Legally, that is the framework that they activated. And I know you asked about NATO, and we only have fragments of information about the NATO involvement from different countries. We have from Italy and from Germany, various NATO generals being in charge or being present at meetings and talking about how they have to keep the document secret. That's another thing that was very shocking, is that not just in the United States, but in every other country that we looked at, the agencies and the commission, the committees that they created for the COVID response were all secret, not subject to FOIA, and their you had to have a high security clearance to even be a part of those meetings. So again, that's not public health. So for the lay person, a public health response is as follows, and this is how it was in every single disease outbreak before COVID. There's outbreaks of certain symptoms in people, and they find clusters of symptoms that and they can't find the virus or the cause of it, the pathogen that causes it, because it's not one that they recognize. So they try to find out what the pathogen is. They find the pathogen. It might be Ebola, it might be MERS, it might be SARS-1, it might be SARS-CoV-2. And what they do is then they treat the symptoms of the patients. If they have to isolate them, they might isolate them and make sure that, people don't come in contact with them for a little while. And everything else goes on as normal. That's it. That's the entire public health plan. And that's why in January and February, they told the public, don't worry, just wash your hands, stay home if you're sick. That's the public health response for every single disease outbreak in the history of humankind. Even the plague, even the 1918 Spanish flu, that's the response. And so the fact that they suddenly pivoted in March, and all countries pivoted at the same time in the same way with very, very similar emergency declarations and other laws that were invoked to a lockdown until vaccine response, that is a national security response. That is not a public health response. So that's for the layperson.
Yeah, and when I look at your report, what's so striking to me is this wasn't just the United States. The same thing. You've got here the people who were leading this, the agencies in Germany, in the Netherlands, in Canada, in Australia, in the United Kingdom, in Italy. Clearly, somebody was coordinating all of this. It's absolutely fascinating. Before we wrap today, I definitely want to ask y'all's thoughts about Donald Trump. Was he a victim here? Was he deceived? What do you think he knew about all of this? But I want to go back to you, Sasha. What do you make of this? I mean, what is the significance of this for an average American? And looking at what the Congressional Select Committee on the COVID, looking at what they put out, this silliness that the vaccine saved millions of lives and stuff. What do you think about the information that's been given to the public so far by Congress, by the fake media? What else needs to happen going forward here?
Right. This is an excellent question. So this is a very simple litmus test for anyone who wants to understand whether they're being lied to by the source, regardless of the source, or whether the source is telling them the truth. So the sources that are telling you there was a terrible pandemic, we had to respond, there was a public health crisis, such as the Congressional Committee report, those are lies. And there are numerous reports like this commissioned by many governments, including Canada recently just published. I've seen several others, different states commission similar reports. If the report starts with there was a terrible pandemic called COVID-19 and there was a public health crisis and we had to respond, and then goes into, vaccines maybe were dangerous and maybe this was bad, all of it is a lie, okay? So disregard that. They're lying to you because it wasn't a public health event. It had nothing to do with public health. It was a set of frameworks that were triggered based on secret criteria, which we still don't know, secret authorities, which we still don't know. And it was a CBRN type of a response, or, the response to a biological or chemical or radiological weapon. Now, the reason we know that is I uncovered a recording from an internal meeting at AstraZeneca that discusses this, and this is Pascal Soro, CEO of AstraZeneca, talking to VP Mark Esser, who was responsible for monoclonal antibodies. And they're saying that on February 4th, 2020, they received a phone call from DARPA, from Colonel Matt Hepburn, telling them that COVID was declared a national security threat and that they needed to switch to COVID vaccines and therapeutics. And so the question needs to be asked today from everyone, regardless of a political party. Why did Matt Hepburn make that phone call? Right. What authority did he have to make that phone call? And on what basis was COVID determined as a national security threat?
And I'm going to add to that, Sasha, why was the public not told that there was this crazy crisis? In fact, this happened in multiple countries. They secretly invoked these laws and created these commissions for responding to a national security crisis, but the public wasn't told.
Yeah. Why weren't we told? Why is why is congressional report not mentioning this fact? Why are they not bringing Matt Hepburn into Congress and asking him these questions? I'm not saying he's the mastermind, although he claims he's a mastermind of pandemic preparedness plan publicly, but I'm not saying he's the main criminal. He's just a key witness and needs to be questioned. And so until this happens, we have no clarity. Right now, all these reports, it's called pacification and control transition period, where everybody come down, we're investigating, our side won, we're just around the corner, we're going to punish all those responsible. And you know what's going to come out of it? So just now, Trump announced Anna Paulina Luna is in charge of declassification, including the origins of COVID and so forth. I guarantee you, I'm willing to bet they're going to come back and say, oh, China made bad virus, gain of function virus in Wuhan because Fauci let them and gave them money to. And well, that was bad. But you know what? Fauci is already pardoned. And that's because Biden bad. That's it. Go home.
That's exactly right. Sasha's exactly right. They're going to turn it into here are the three things. When you hear these three things, you know that your attention is being diverted. Blame China, blame the Wuhan lab, and blame Fauci.
Yeah.
Those three things, which is all anybody focuses on, are all diversions because China was in on it. The Wuhan lab is just a place where they do research on bioweapons, and it could or could not have been the origin of it. That isn't another thing you need to realize is the virus did not devastate the world. The response devastated the world. Therefore, we should be looking at the origins of the response, not the origins of the virus. So any investigation that focuses on the origins of the virus is missing the entire picture.
Exactly. Wow. The origins of response is what we need to address, not the origins of the virus.
So I'll confess I'm a big fan of Anna Paulina Luna. I think she's got a very solid record in Congress. And so I've got to ask you this. Is there a possible innocent explanation? I mean, is there any way that all this could have happened legitimately? There was nothing nefarious. These guys looked at this virus and said, whoa, this looks like it might be a bioweapon. Got to get ready because if this kills a whole bunch of our people, we're in trouble. Is there any way that there could be an innocent explanation to this is my question.
Right. So I want to address that. So in the past, pandemics did not exist. There's no pandemic. Definition of a pandemic is a simultaneous mass illness and death exceeding all the previous mass illnesses and deaths in human history occurring simultaneously all over the world. That does not exist, never happened, okay? Now, epidemics have been historically declared. An epidemic in a public health sense, this is non-nefarious, benign, public health sense, epidemic can only be declared retrospectively. After you've collected the data about this current season, mortality and morbidity, and you compared it to the previous years and it exceeded certain thresholds, then you can say you had an epidemic. So it's nonsense, it's absurdity to take a code, some sort of a random code, genetic code that was uploaded on January 9th to GenBank from China, and then say, oh my God, this is a pandemic virus. It's not, even Ralph Baric, so I've published on this, I've read several Ralph Baric's long reports. He co-authored a gigantic report, it's like a book on bioweapons published by National Academies of Science in the US. They're it's not just him, there's numerous very prestigious authors of this book. They all unanimously say, we do not have scientific knowledge that today can predict from the genetic code how dangerous the virus is going to be, or even if it's going to infect anyone. So how is this possible that they have a sequence that somebody uploaded? By the way, those sequences, they're not accurate. They're always consensus sequences because PCR is error prone. So you have to do numerous runs, then average it out, and then say, well, sort of like this sequence, right? But it represents nothing. It's an averaged, it's an averaged code.
And I'm going to add to that, Sasha, because that's the scientific explanation. So Sasha just gave you the scientific explanation for why it could not have been innocent. The public health and national security reason is, even if they thought it was a bioweapon that was going to kill a lot of people, why didn't they tell us? Number one. Number two, if they knew it on February 5th, 2020, why did they only start implementing measures on March 13th or 18th or 15th, depending on the country or the state. So they
That's a very good question.
probably have been innocent. Even if they all believed that this was a terrible bioweapon that China created at the Wuhan lab and Fauci funded it, and they still didn't tell us for a month and a half.
Yeah. No, I agree. That's a very, very suspicious, because I could understand maybe an abundance of caution. Maybe you don't want to tell the public so that there's no stampedes and societal meltdown. But yeah, if they really thought that, it'd be very weird to hide that from us for a month and a half and just say, yeah, just wash your hands, guys. No big deal. Very concerning. I want to ask you, oh man, we're running out of time so quickly, and there's so many things I want to ask. I'll start with one that is, I think, at the forefront of a lot of people's mind right now. We've seen some bizarre statements by people like Peter Hotez, or whatever his name is, that there's going to be a lot of new pandemics as soon as Trump gets in the White House. We've seen this craziness with the bird flu. We've seen all these pandemic preparedness things, like the CEPI down in Rio and the bird flu summit in Washington, D.C. Are we at risk of something like COVID hitting us again in the next few years?
Well, we are currently under a response. So again, don't focus on the virus, avian flu virus, mpox, whatever else Peter Hotez is advertising. Don't focus on the virus. Focus on the response.
Yes.
And what are these people doing? So today, I live in Tahoe, very prestigious place, ski resorts, no eggs. Haven't been any eggs in the stores for 10 days now.
Here too, same deal.
Right.
Yep, in
Because
Florida.
why? Because CDC killed all the chickens. The chickens are not sick. They just PCR. This is the fake PCR that they desperately needed to introduce everywhere as if it's a diagnostic test. It's not a diagnostic test. It hasn't been approved as a diagnostic. It's a lab trick. And they are using this lab trick to declare normal chickens and normal cows super pathogenic and pandemic, and kill them all and crash the food supply. And after they're done with that, this is what Peter Hotez is advertising. This is how more pandemics will be introduced, is because they now have the full legal structure that they haven't turned off, and they're continuing with the same plan with just different brand names.
That is terrifying, absolutely terrifying. We're down to just about 5 minutes left, so I've got to ask about Trump. I mean, I know none of us can, know what's in a man's heart, know what a man is thinking, but based on what you have seen with these military preparations, I mean, Trump, of course, is the commander-in-chief of the U.S. military. He was when this stuff was happening. Do you think he was deceived? Was he misled? Was he a conscious participant? What could he have or should he have done different to try to protect us from what followed?
So I think that anyone who thinks that Trump was the one who declared the emergency because out of his own authority is wrong. I think it was a coup by the military and the intelligence and, the larger sort of military and intelligence alliances that were in charge. That doesn't mean he didn't know. That doesn't mean that he couldn't have done anything as the commander-in-chief. So I believe that he was told that this was a dangerous bioweapon that had leaked. And I think he was told that by Tucker Carlson on March 9th, 2020. That's my understanding from the historical record. We don't know what Tucker said, and he's never going to tell us. But I do believe that he was the emissary. I think he told that to Trump. I think the same thing happened with Boris Johnson and a few other leaders who were resisting the whole ridiculous panic that was being induced. And they told him that, and they said, if you don't listen to us, everybody, millions of people are going to die. And by the way, there's this amazing vaccine. It's going to cure everything. You're going to be a hero, and we're going to have a vaccine against everything now once this thing comes out. And I think that's what happened. I think he realized pretty fast that crashing the economy and locking everyone down was really, really bad, and that it was making his reelection pretty near impossible. And so he started tweeting out things like, we need to open up. When I saw that, he's the president of the United States. He doesn't need to tweet, we need to open up. He can just say, we're opening up.
All right. And then they took away his accounts, and you can't post anymore. And it's just totally crazy what we just lived through. I can't even wrap my head around that. Guys, we're down to just a few minutes left. Going forward, right? There are new people now. Approved by the Senate, running the U.S. Department of Defense, running the Department of Justice. where should we be going here? How do we, of course, Fauci has a pardon, but we know there's at least 17 state attorneys general looking at criminal charges here. But what can and should be done to not just bring accountability for what happened to us, but to make sure something like that never happens again? Do we need a new investigation? Where does it even begin? Let's start with you, Sasha.
All right, so my main point is, yes, you need to look at the origin of response, do the proper investigation, unclassify all of this so that this can be now clearly examined, what exactly happened. And then the most important part is the law, the legal structure that they're utilizing. What they're doing right now is actually on paper legal. So all this bad law, evil law, the EUA, the public health emergency, the pandemic preparedness, all these like exclusions that they gave to all these countermeasures, all of this needs to be nullified. Yeah. So it's actually a pretty straightforward mechanism. You just strike that law and you say it's nullified, it's bad law, it enabled all this nonsense. That would be my plan.
Debbie,
go ahead.
If they are acting in good faith, it's very easy to do.
Yes.
Okay, and so who needs to be punished? I mean, Fauci, okay, a whole bunch of these guys got pardons, but we've got, Robert F. Kennedy, hopefully at HHS. We've got Pete Hegseth at Department of Defense, Pam Bondi, and I know there's some really good prosecutors right now working at DOJ. Who do we go after first, and how?
DARPA and BARDA officials, for sure. They're clearly part of this. And then whoever they point to, whoever made them,
and whoever was on the National Security Council and making those decisions, and
exactly.
Whoever were the military leaders, and whoever approved the EUA products. I mean, we have the officials who signed the documents approving those countermeasures, but there's so many. I feel like prosecuting individuals is almost beside the point. I mean, we can do that, but it's much, much more important, like Sasha said, to dismantle the legal framework and to get to the bottom of the classified information. Those are the only two things that we really should be worrying about right now.
Exactly.
Yeah. My guess is the paper shredders in Washington, D.C. are running 24/7 right now, trying to get rid of evidence here. This is absolutely fascinating. I do want to encourage folks to follow both of you and your work on Substack. Debbie, let's start with you. How do people follow your work? What's the easiest way? Are you on social media?
I'm not on social media. I believe it's anti-human. So you can follow my Substack, debbielerman.substack.com.
Excellent work. Thank you guys for doing this. Sasha, how about you? You have the excellent Substack as well. Are you on any social media?
My primary source is the Substack, sashalatypova.substack.com.
What's the easiest way for somebody to get a hold of this report and send it to their member of Congress, their local sheriff, their state attorney general? How do people get this?
It's on both of our Substacks published. So, and I also put it in my pinned post just at the beginning, and so that's how people can find it. And we can send you the link as well to publish with this.
And thank you. That's a great idea. Anyone who wants to copy it and paste it into an email and send it to their congressperson, that would be lovely.
Absolutely. Folks, that is a really easy takeaway from this. Grab the dossier. It's called the COVID Dossier. You can find it on either of their Substacks. We'll put it out as well. And send it to your sheriff, send it to your state attorney general, send it to your congressman, send it to your U.S. senators, and say, we demand answers. We're almost out of time here, folks, but I do hope you'll go follow these two ladies. They spend a lot of time researching this stuff that really needs to be done. And you know what? USAID is not writing any of us any big checks. So get over there, follow their work. If you can, support it. And also, take this information and do something with it. Don't just throw stuff at your TV and huff and puff. We've got to get busy. We've got to make sure they never do something like that to us again. It is absolutely essential. Our freedom is on the line. Our country is on the line. And I want to thank you for tuning in. This is Behind the Deep State. I am your host, Alex Newman, Senior Editor at thenewamerican.com. The New American. If you're not signed up for the magazine, do so. And until next time, God bless you all.
Freedom is the cure. You're dead on. This is the largest experiment performed on human beings in the history of the world. The more you know.
What they're doing is they're forcing vaccination on people, and I believe they are killing people with this vaccination.
The freer you are.
It's murder. They are basically murdering people in hospitals.
The all-cause mortality we know is now higher in the vaccinated group than the unvaccinated group.
Stay informed on the issues that affect freedom. Get a subscription to The New American today. thenewamerican.com.